Public health officials say more than 80% of Canada's cases are related to travel or traced back to someone who traveled. There is some community transmission, but not a lot, and the government is enlisting Canadians' help to keep it that way. Coming up, we'll be taking your questions about the virus and how it spread. One of those steps the government is taking to protect Canadians is to restrict Americans from coming to Canada. Prime Minister Justin Trudeau says he expects the new restrictions at the Canada-U.S. border to take effect tomorrow night. Yesterday, the Prime Minister and the U.S. President, Donald Trump, agreed to stop travelers from crossing the border for recreation and tourism purposes. The CBC's Evan Dyer has the latest from Ottawa.
Well, Carol, today we saw Justin Trudeau coming out of his self-isolation in Rideau Cottage, as he has for the last few days, and really taking on this sort of reassurer-in-chief role, if you like, leaving the details mostly to the cabinet ministers who appear afterwards with the public health officials. Today, he was focused very much on reassuring people about money matters, that the government has the ability to spend, intends to spend, is not going to stop spending until this crisis is over. And he also spoke to some specific groups. We've heard him in the last few days addressing groups like students, like people who have to pay mortgages, people who work in the oil and gas sector, and so on, reassuring them that they will be able to get through. Let's listen to a message he had today for a group who may be very worried about their savings and their pensions, and that is people who are retired or approaching retirement.
The market disruptions are massive, and many Canadians have seen their retirement savings and pensions reduced significantly. We will be taking measures to ease the impact of that. We know that our seniors have worked hard all their lives to be able to retire in comfort, and there is a lot of anxiety there. That's why we will be there for our seniors as well.
So obviously not too many details there on that. Some initiatives that have been rolled out have quite a few details attached to them, and we already can see more or less how much they're going to cost. Others, like mortgage deferral, really no details as yet. That very much remains to be sorted out and really depends on banks. It really is based on a conversation between Finance Minister Bill Morneau and private bankers. But it remains to be seen just exactly how many people will be eligible for these deferred mortgages. Let's talk now about some of the medical facts that we learned today from the ministers and the public health officials. Dr. Theresa Tam, Chief Public Health Officer, gave a rundown on coronavirus cases in Canada. She says that over 80% of COVID-19 cases detected in Canada are still traceable to travel. That doesn't necessarily mean a person who has traveled, but it does mean a person who has been in contact with someone who can be confirmed to be outside of the country. There are two other kinds of cases. There are the cluster cases where there's no necessary connection to travel, but they are linked to a particular location in Canada, such as a critical or a long-term care home, I should say. And then there are the most alarming kinds of cases, the pop-up cases, where medical officials aren't able to trace them to any other case. They don't really know where that infection is coming from, but she called on everybody to continue to exercise precautions, social distancing, and to try to, as we've all heard the expression now, flatten the curve. Let's watch Dr. Theresa Tam.
In countries like China, like South Korea and others, they had many more cases, of course, but it took them quite a few weeks and overall about 2.5 months in order to get their bigger outbreaks under control. So what I would like to see in Canada, of course, is to not even get there, but which is why I'm saying, plank the thing, plank it right now.
Lastly, Carol, I should mention that one more member of the Trudeau cabinet has gone into self-isolation. The third, after the Prime Minister himself and Mary Ng, is now François-Philippe Champagne, Canada's Foreign Minister, who tweeted today just before 2 p.m. that he's experiencing flu-like symptoms and that as a precaution, because he was out of the country fewer than 14 days ago, he's going to self-isolate. He's taking a test to see if he has the coronavirus, but the results have not yet come in, and so he's going to be working, but in private, as we've seen with so many other people. He was indeed out of the country about 2 weeks ago. Let's look at where he was. He traveled first to Latvia, where he met with Canadian troops on the NATO mission there, then went to Kiev for talks with the Ukrainian government, was also in western Ukraine, in Yavoriv, meeting the Canadian soldiers who were stationed there, and his last stop was in Warsaw, Poland on the 7th of March, so 12 days ago, back in Canada 11 days ago, and appears to have met with a number of people since then. So he has actually, just within that 14-day period, really in a couple of days, if he's still not tested positive for COVID-19, he would normally be considered medically in the clear. But that is yet one more member of the Trudeau government having to self-isolate during this pandemic. Carol.